let's hear what she has to say.
Well, thank y'all very much for having us today. We really appreciate it. Travis Potter is actually going to come up and then introduce Dr. Witherspoon. We're excited about launching a new program within our county, and it's our sports medicine program. And so Travis Potter is our Director of Service Excellence, and he is leading this charge. So let's give him a big round of applause.
Thank you, Sonia, and I just want to say thank you for having us and allow us the opportunity to speak about our sports medicine program. And I promise I'll be brief, and we'll get to our main star in just a second. But I did want to speak a little bit about the sports medicine program and what we've been able to develop so far. I've been working closely with Chad Martin, and really over the past year or so, we have partnered with between 5 and 10 of the local school districts in the area to provide a wide array of services depending on their needs. And that's something that I think that we've focused on with our program, is to be very flexible depending on whether it's a bigger school district like Greenville ISD or even a private school system like Greenville Christian School. So we work with all sorts of different school systems. We have done things like provide athletic training services. So schools that don't have an athletic trainer on the sidelines for football games, it puts the kids at risk when they don't have those type of healthcare professionals there at the games. And so we've been able to provide that for some of the schools that have not been able to do that in the past. For Greenville in particular, we've been able to provide physician coverage on the sidelines. Me, myself, being a Greenville High School alum, that's something that makes me very proud that we're able to do that sort of thing for Greenville ISD. Something that you would only think of 5-10 years ago, being at some of the bigger schools in the Metroplex, having a physician at high school football games. Now, Texas high school football is a big deal, so we had to play a little bit of catch up, but we're getting there. And one of the things I'm most proud of that we have done for our community and the different schools is in the springtime, and Dr. Witherspoon, who actually started his practice in June, was able to come in a little bit early and help us with this in April and May. But with those 5 and 10 schools that we partnered with, we were able to provide school physicals for those kids. We would go to the schools and provide those school physicals that are necessary and required by the state for them to participate in sports. And we were able to do that for we tallied up between 2,500 and 3,000 kids in the area. And a lot of those kids that we provide those physicals to at no cost, previously weren't able to do that because of the cost prohibiting them from being able to play sports. And so I think that's a great achievement that our program has been able to accomplish over the past year, and we're going to continue to do that moving forward. And we're going to continue to build our sports program and develop relationships with more schools moving forward. One of those schools is above the high school level, which is A&M Commerce. And that's where Dr. Chris Witherspoon comes in, because Dr. Witherspoon has had a presence in the North Texas area for really the past 20 years, working with different universities and high schools. He had a prior relationship with A&M University in Commerce, and so he is actually going to be patrolling the sidelines there on Saturdays this fall for their football games, as well as the high school level at Greenville GISD for their home football games on Friday nights. So if you don't see Dr. Witherspoon on the weekends, you know he's watching football somewhere. He's going to be a very busy man. So with that, I will introduce Dr. Witherspoon. As I said, he has been with Hunt Regional and started his practice in June. Before that, he has 20 years of experience throughout North Texas. He started in Lubbock with a sports medicine fellowship there, and has just moved throughout Texas, and we're really happy to have him on board, and I'll let him talk to you guys a little bit about what he does with not only sports medicine, but primary care as well.
Thank you so much.
Almost lost that. That would have not been good. Thanks so much for having me. Yeah, I've been all over North Texas, which is true. I'm a University of Texas grad, so some of these places I kind of snuck around. I didn't tell anybody I was a Texas grad, especially that first job in Lubbock. I still remember being hit by a tortilla during the Texas Tech game as a spectator. Fortunately, no injuries, no concussions, but they were passionate about their disdain for Texas. So I did not have orange on that day. I just kind of snuck into the stadium, watched, and it turned out okay that day. But anyway, so I'm a primary care sports medicine doctor. What that means is that I'm family medicine trained, so I did a fellowship with Baylor and through Garland, and then I did my residency, with them in family medicine, and then I did my fellowship with UT Southwestern at Charlton Methodist in Dallas. And so I've got specialization both in family medicine and in sports medicine, which I always get that question, what is primary care sports medicine? And basically we're the best of both worlds from the standpoint of we can truly take care of the entire athlete. Nothing against my orthopedic counterparts, but obviously they're traditionally focused on the musculoskeletal system. And so where we come in is we're kind of the initial evaluators. And so if an athlete comes in with a variety of problems, and athlete is a loose term, I see athletes from 5 and up. So we have athletes of all ages, all skill types, weekend warriors. I even was going to tell a quick story. I had a dad who went with his daughter to a haunted house, and something scared them, and she was able to run away, but he tried and ripped his hamstring. So be careful when you're running from scary things, because there is a potential peril that can follow. But we kind of do everything. So athletes not only have musculoskeletal problems, they also have obviously skin problems. There's certain skin conditions that can be excluding for participation in sports. Obviously, we'll talk in a minute, but concussions have really come to the forefront. You see it in the news, the media, all the chronic traumatic brain injury reports of athletes over the years. And so what we're trying to do is prevent them from progressing to that point. And that's become a big part of my practice over the last few years, especially as we've gotten more educated, really. And that's doctors too. I mean, we used to, the kids would come in and we'd say, yeah, you've got a concussion, sit out for a week and go back. And now there's very specific guidelines, there's observation periods, there's progression that takes place that makes sure that they can tolerate the activity. So we're much better educated. We can educate the patients and most importantly the coaches, because they tend to be a little more, harder to, they're trying to understand kind of what our thought process is. So that's been part of what we do as a primary care sports medicine physician. Sports injuries, obviously, first and foremost, we see pretty much everything. Musculoskeletal, I really come in and do the evaluation, and then I can determine, yeah, you probably do need to see an orthopedic doctor, but a lot of times you don't. If it's an overuse injury, if it's something that maybe is postural, I can't tell you how many times I see tennis elbow. It never comes from tennis. It comes from computers, it comes from posturing, the way you sleep at night. There's a lot of different factors in that, and so a lot of times we can correct something like that with a simple brace and time and changing the way you do things day to day. So that's really where we come in and help. And it does help the orthopedic doctors too, because they like to be in the OR. That's where they obviously are most effective. They like doing surgeries. That's why they're orthopedic surgeons. So they like having someone like myself, because we can take some of the stuff that doesn't need operative treatment off their schedule. A big part of what we do is we want to make sure a little bit of a difference between a primary care sports medicine doc and maybe your routine doc is that we try to keep you going. So let's say you come in with an injury, right? But you can still, let's say you've got a knee injury, but you can still do some other activities. We really make it our goal not to just shut you down and say, you're out, sorry, you can't do anything for 4 weeks. Instead, what we do is we say, okay, what can we do? Arm ergometer, there's all kinds of things that are available that we can keep your conditioning up and also progress you through your rehabilitation. So that's a big role in what I do is I always evaluate and say, what can we keep you doing and staying active so you don't just kind of sit and atrophy and lose your conditioning and all the things you worked for. Obviously, we work with a lot of athletic programs. Travis kind of did a summary of a lot of the schools. We're very excited about relationships with all of them. We're also having a really good progress with A&M Commerce, and that's very exciting as far as our role there. Looking forward to taking care of. They have some special athletes, as you know. They won the national championship in football, I think, 2 years ago, and I think Coach Bailiff's coming next week to speak to you guys. So that ought to be interesting, and that's quite a get for A&M Commerce to replace their past successful coach. So we talked a little bit about concussion management. That's a biggie that we are really seeing more and more patients for. Obviously, it doesn't take much to sustain a concussion. This image, it looks like this young lady's come off her bike and hit her head. You can sustain a concussion opening your car door. I don't know how many people have. We see a lot of car door. Windy days, especially in Lubbock. I saw a lot of concussions in Lubbock because people would open their car door and the door would get blown back and hit them in the head. So, and that's something that can occur. It's not just a sports injury. It's unfortunately a motor vehicle accident injury, anything, doing stuff around the house. So we do see concussions. Certainly we treat our young people the same as our experienced athletes, and there is a progression that takes place with concussion. So the science has gotten better. The diagnostics have not gotten better. I have so many people ask me, can you do a CAT scan or an MRI for a concussion? And you guys probably know you can. Now certainly we can look for bleeding, we can look for more catastrophic issues from the injury. But concussion is a diagnosis that we do in the clinic, and so there's a lot of great ways now for us to look at balance and cognitive abilities and different things that maybe are hidden a little bit, so they don't have that goofy look in their eye, but their balance is terrible, or their cognitive abilities aren't as quick as maybe they were before. So those are some ways we tease those out in the clinic and see what's going on. So I would say never, if you suspect a concussion, have it evaluated. Never just say, well, you probably just rang your bell. Because a lot of times, people are very good at hiding their symptoms, but what they don't realize is if they sustain another injury, it's easier and easier to get another concussion. And so that's problematic. So we really try to avoid that sequence for the patient and try to interrupt the process and educate them on things they can do to kind of help prevent future concussions. So any questions or anything? Yes, sir.
Usually you have to go to a family physician in order to get to you, or can they?
Well, no, that's the beauty of me. I am family physician. Now, if you have an HMO, that may be a little bit of a problem just from the standpoint of if you already have a designated primary care physician, then you would have to get that changed over to me. But I always tell all my referring physicians, we want to keep you with your family doctor. And I mean, I'm certainly happy to take on patients if they're interested in letting me do all the above. But that would be the only scenario where maybe you might need a referral. Instead, what you would need is just a change of PCP, and then you can always change that back. Does that make sense? Yeah.
I just saw an article yesterday about a 28-year-old boxer died with a head injury. That's concussion.
Yes, he probably had a delayed bleed. I saw that one. Was he the Russian boxer? I think that. Yeah, I think I did see that. Yeah.
I couldn't pronounce his name, so I guess he was Russian.
Yeah. That scenario, you think about something that's called an epidural injury, and those are the most scary. So that's the kid or the boxer or whoever that gets hit, they go down, they're out, but then they wake back up and they seem fine. And then you see this slow, steady deterioration that occurs. And that's the bleed. And it's a real slow bleed, and when the cavity fills, there's nowhere else for that brain to go, and it's a bad situation. So we watch those very closely. We thought we had one last year at a football game. Thank God we didn't, but that's a scary history.
Treat them as a reliever of depression.
Yes, sir. Yeah, that's call your neurosurgeon, get them in ASAP, because they've got to basically open the skull cap and relieve the pressure. Yeah, so yeah, it's not good. So we hope we don't see those. That's one you want to avoid in your career if you can. Yes, sir.
A lot of those symptoms that you describe sound to me like old age.
It is, and we do have that ICD-9 code, but traditionally, what we would do in that scenario is I would look over to a spouse, friend, significant other, and say, "Is he always like this?" And typically, they can help delineate what's new and what's not. So, yes, sir.
Well, have you hit your head with your car door lately?
It was, yeah.
So you mentioned prevention.
Yes.
A little bit. Can you speak a little more maybe like on nutrition and maybe some other things and like preventing injuries?
Oh, absolutely, yeah. And there's so much to talk about, but that's always a big problem is the lack of pre-activity stretching and post-activity stretching. And so we do talk a lot about what can we do to prevent this next time, and then sports, these mass participation physicals that Travis was talking about, we do our best to tell the kids, make sure you stretch, and we sound like another parent, I'm sure, but that is a big part of why we see so many folks with injuries. There's no adequate warm-up time, and really the literature is pretty consistent that says your biggest benefit in stretching occurs after activity. And so spending that, you're exhausted, you're tired, you want to just go eat something and rest. If you spend that extra 5 or 10 minutes doing some post-activity stretching, your tissue's more pliable, you have a better stretch, and long term, you'll see faster results on your flexibility and that sort of thing. Nutrition's a biggie too. And I can't tell you, I again, at a high school game last year, a kid was puking halftime, and we're like, "What'd you eat before the game?" McDonald's. I mean, there's just so much that we can do to improve not only just general nutrition, but especially pre-activity nutrition. And we really have worked with our athletic training staff to try to convey that to the kids of how important, you are what you eat, which, the best athletes tend to have a very rigorous dining table, that they follow, and the universities are that way now. Again, I trained in Texas, so I was there when it was David McWilliams, and I was involved in some tutoring of football guys, and so their food was terrible, and now, they have nutritionists and meal plans, and based on kind of what their body analysis is, they really changed their carb, fat, protein percentages, so it's gotten past my knowledge base to where I work with a nutritionist or a dietitian. I can give general guidelines, hey, you need this much protein, you need this much fat, this much carbs, but for some of those really elite athletes, it pays to have them spend an hour with the dietitian and really get some firmed up calculations so they know what they need to be doing. So, yes, sir.
I remember I played football in elementary school and up through high school. But now you said there was not really a way that you could tell if someone has had a previous injury or...
Well, you go by history on those, but now, and I should preface this, there is some exciting new laboratory testing coming out, and there's actually one test that's starting to be incorporated into emergency room use, which is a blood test that looks for a certain protein that can be released when there's a brain injury.
When it's
basically.
actually
Yeah.
active and new and fresh.
Exactly. So that's promising. Of course, it costs $1 jillion, and that'll evolve like it always does over time, and we will see probably more use of that. Now they're getting these slick field test kits, so I'm sure one day we'll be able to do some kind of finger stick and see if this line pops up, and if it does, then we can presume there's a higher risk for head injury. I always say, I follow the no-duh rule, and my rule is, if that kid comes off like this, or that kid's laying down and they say, man, he wasn't moving for a minute, we're done. I mean, and the coaches don't always like that, but it's just not worth, because the kids hide their injuries very well. They're very balanced. A lot of kids who've had these injuries before, they know what we're going to ask them before we ask them, because the questions can be sometimes repetitive. We do try to vary that, but they learn, and they're smart, and they know the answer we want to hear. But what we can do is tease out some things you can hide, which include balance testing, ocular motor movements, of the way their eyes move when we ask them to follow us with a finger, or follow our hand movements. So there are subtleties that you just can't hide because the brain is truly injured. But those take some time. Obviously that evaluation evolves over the next 15 to 20 minutes. The biggest thing we do is we do an initial, it's called the Glasgow Coma Scale, and it's what all your EMTs do. Did you tell me are you in medical? Was somebody here? Oh, okay. I thought somebody here was medical, but that's something they do for anyone who's had a head injury. It's like a quick 15-point eval, and based on that measurement, you either call care flight, or put them in an ambulance, or you can observe them there on the sideline. So the answer to your question is, typically those are stories of history, and we get multiple inventories. So we don't just ask the kid, we make sure the parent's involved in the questionnaire too. But sometimes the parents don't like to tell us either, because they want to make sure that we don't take the kid out for too long of a period of time or something like that. So it's a battle.
Well, the coach used to just pick you up and pat you on the butt, and if you could stumble off, then,
Yeah.
that was it. That was
Yeah.
treatment.
Yes, sir.
Take a couple minutes and share with us what the rehab component and services that you offer are.
Oh yeah. And I was going to say, one of the things that's been great about this position is Hunt Regional has been very visionary in letting us develop this program. Primary care sports medicine in the South is still, even 20 years later, it's just not terribly well accepted, which I don't understand why, because we're a team all working together, and Hunt Regional's been like, yeah, let's do this. You're going to work with an orthopedic doctor, which we'll have orthopedic surgeon here joining us again soon, working with our sports medicine program. We have one currently, and we're working with another one. But we also have a great sports physical therapist, Terry Sadler, who is outstanding. And I mean, I've already referred a number of patients to Terry, and it's amazing how quickly PT can accelerate your recovery. We don't want to do it. It's extra time, it's extra cost, it's extra effort, but it is it's money well spent, it's time well spent, and it also gives you ways to prevent injury in the future. So it's very nice that we have sports therapy. Obviously at Hunt Regional, we have all the imaging necessary, CT, MRI, plain film, and I'm trying to think what else. Oh, we have a nutritionist. So I've referred an athlete already over to nutritional services to do an evaluation and kind of look at, hey, what are we doing wrong here? He was kind of bonking, or hitting the wall, losing his endurance. And I think it was a bit of overtraining and dietary deficiency, but long story short, we have that right here. So we've got great services. I'm very excited about this program. I think we're going to be able to offer a lot to the community, and I'm happy to see you. Like I said, I do family. Everybody's an athlete. Doesn't matter when you do it, how you do it. But if you do have a problem, I'm happy to see you for that, and I appreciate the time.